Really happy to be here today. My name is Gary Cohen. I'm the president of Healthcare Without Harm. Healthcare Without Harm's mission is to transform the healthcare sector to be environmentally sustainable and to be leading advocates for environmental health and justice in the communities and on the planet and in the societies they operate within. Why healthcare? Well, healthcare in this country is 18% of the entire economy, and it represents some of the same contradictions that the rest of society has, being fueled by fossil fuels and toxic chemicals and industrial agriculture. So it is an enormous polluter. And so healthcare uses an enormous amount of energy, mostly fossil fuels. It creates an enormous amount of waste. When we started Healthcare Without Harm 19 years ago, medical waste incinerators were the largest source of dioxin emissions in the United States and a large source of mercury emissions. It produces an enormous amount of pharmaceutical waste that winds up in our public waterways. It's the largest, one of the largest sectors using toxic chemicals. Poor indoor air quality has been identified as one of the leading causes for work-related asthma in healthcare workers, especially nurses. Until recently, has been serving food that's basically unhealthy and is completely out of alignment with their clinical mission to do no harm. And why the healthcare sector as well is because it's the one sector in our economy that lives within an ethical framework to do no harm, the Hippocratic Oath. So it creates this enormous sense of responsibility that not only should it not be polluting the environment, but it should be leading in modeling the kind of sustainable business practices that we want the rest of society to operate within. So we started as, well, let's focus on the problems. And so when we started the organization in 1996, there were about 4,500 medical waste incinerators. And over the course of a decade, this sector completely moved away from incineration, figured out how to recycle a significant portion of its waste that was possible, figured out how to reprocess medical devices, figured out how to basically save money in the process. So it's had an enormous positive impact, and no longer is healthcare anywhere near a source of dioxin emissions in its operations. Second, we took on what was an iconic measuring device, the mercury thermometer. When we started, the Centers for Disease Control was saying that there was enough mercury in children in utero that could be impacting their brain development. So if we're really concerned with the first 1,000 days or the first 5 years of a child's life, we should not be contaminating children in the womb. And so healthcare was a significant part of that problem. And so we started with one hospital in Boston to convince them to eliminate mercury and use safer alternatives. That spread to all the hospitals in Boston and all the hospitals in LA and Chicago and San Francisco. Eventually 5,000 hospitals committed to eliminate mercury, not just blood pressure, not just mercury thermometers, but blood pressure devices and other fixatives, et cetera. All the pharmacy chains in the United States agreed to stop selling mercury thermometers. And within about a decade, mercury was being completely phased out of healthcare in the United States. We then were able to win legislation in Europe to phase out mercury, and then partnered with the World Health Organization, and a year and a half ago won a global treaty phasing out mercury from the healthcare by 2020. The power of that is also that if we don't want mercury in hospitals, we probably don't want mercury in other products as well. And so the treaty, the Minamata Treaty is what it was called, became a very powerful validator for showing how the healthcare sector could lead by example in detoxing its own supply chain and create the story and the momentum and the inspiration for other sectors to follow suit. So in the Roman pantheon, Mercury was the messenger god. And in the same way, in healthcare, mercury has been the messenger for environmental health for the sector. Because mercury isn't the only chemical that is in children in utero and in our bodies. There's hundreds of them. And there's hundreds of chemicals that are problematic in the supply chain of healthcare, in the buildings that we have in the medical devices. And so there's a much larger mission and much larger story for which Mercury was a clarion call. So when we think about what else can we do to detox the buildings, how can we make healthcare institutions models for a healing environment? How can we take out the toxic chemicals? So a very powerful example recently is to say that once the governor of California said that hospitals could achieve flame retardancy without using toxic flame retardants in their furnishings, Kaiser Permanente said, well, we're actually going to only buy furniture now that doesn't have toxic flame retardants and formaldehyde and other toxic chemicals. And because of the network we've built with Kaiser, 4 other large hospital systems said, well, we actually are only going to buy furniture without toxic flame retardants. So within 6 months, there was a demand for $50 million a year for products that would be safer for the hospitals. And that has an enormous impact not only for the healthcare marketplace, because it's actually moved a whole set of manufacturers to say, we're actually going to produce these safer products. But again, it validates the kind of transformation that we need for the rest of society. So if we don't want toxic flame retardants in hospitals in the furnishings, we certainly don't want them in schools. We don't want them in our office buildings. We don't want them in our homes. So it creates momentum at a broad industry-wide level to transform the practices of a whole sector. And that extends to a whole set of other things: flooring, lighting, energy systems. Healthcare can lead by example in the transformation toward a broader, sustainable economy. That's also true in the area of energy. Climate change is going to be one of the mega challenges for us addressing population health, addressing public health. We need to be rebranding climate change as a public health imperative to address. And so there's a lot of movement now for healthcare to both embed energy efficiency into its operations and to lead the transformation toward a renewable energy economy. This is Kiowa Hospital in Iowa, Greensburg, Kansas, that was completely destroyed by a tornado that swept through that town, and 90% of the buildings were destroyed. It's been rebuilt to run on wind power. And that leading by example, again, for the sector is very powerful. So within the last few months, Kaiser Permanente announced one of the largest solar buys of any company in history. And within a couple of years, 50% of all its facilities will be run on solar power. That kind of movement, and to frame that transformation, to say we're not only doing that to provide price guarantees and to address price fluctuations in the energy market, but that they're doing it from the point of view that it's good for their communities, the communities they serve, and that they see themselves within the larger ecology of the communities that they operate within. That's a powerful thing. Another area where there's been enormous transformation, and Larry mentioned this, is in changing the way that healthcare purchases food. And so instead of having fast food joints in the lobbies of the hospitals, now there are farmers markets in hundreds of hospitals around the country. Hospitals are using their purchasing powers to support more local and sustainable food production in the communities they serve. It's a climate resilience strategy, it's an environmental health strategy, it's a patient safety strategy, and it's a worker health strategy, because the workers, the healthcare workers who are spending 12-hour shifts, 18-hour shifts in the hospitals, they're the ones that actually have to eat the food. And so it can address not only the food-related diseases in the communities, but healthcare workers suffer from the same rates of obesity and diabetes and other issues related to food. And it's been a very transformative experience, and it's now extending into the patient experience. So now you have doctors and nurses that are writing prescriptions for fruits and vegetables. they're starting to link up now with the school systems in their communities to say, if we aggregate across the hospitals in our community, if we aggregate across the school systems in our community, can we be anchors for transforming the entire food supply for the region? This is the way that they start to partner with others in the community. We launched an initiative a couple of years ago called the Healthier Hospital Initiative with 12 large hospital systems to say, can we create a series of clear, actionable steps to move the whole sector forward? So we created initiatives around leaner energy, around safer chemicals, around healthier food, around less waste, and around smarter purchasing, and created clear metrics around each of those and how-to guides and case studies, and then got 20% of all the hospitals in the country to adopt it, 1,400 hospitals. And there's some significant data that we were able to collect. And we said to the hospitals, again, it was like what the partnership has done. It's a voluntary program, but you have to commit at the highest level. Your CEO needs to sign the agreement that you're going to participate, and you have to provide us with metrics. And so we were able to get broad adoption of this across the sector. We've gotten data from almost 1,000 hospitals, 46 states, hospitals in 46 states participated. And some of the outcomes have been very important. Over 150 hospitals, or almost 150 hospitals, were able to achieve 18% of their entire food purchasing to be local and sustainable. Almost 450 hospitals were able to save 445,000 tons of materials that didn't have to go to the landfill, and that the market for reprocessed medical devices has dramatically increased. That means not just using one device and throwing it away, but sort of figuring out how to re-sterilize it and use it again. It's an enormous financial savings for healthcare, which is one of the aims of the triple aim, is to save money, reduce waste, improve population health. And where's all this going? So it's really important, of course, for the healthcare sector, given its mission, given its enormous economic clout, given its enormous presence in American society. The only sector of the economy that's bigger than healthcare is the military. So it can have an enormous catalytic impact on the rest of the economy. And we've started to work with hospitals around the country to see themselves as anchor, economic anchor. In 200 different cities, the healthcare institution is the largest employer. It is the economic engine of those communities. And given its mission, then it can play an incredibly outsized role in taking some of the innovations we've said about how you can change your own food purchasing practices, how you can detox your supply chain, how you can make your buildings healthier, how you can reduce your waste, how you can change your energy mix. Bring that out into the community. Partner with the community to figure out how to move toward community-based energy that's based on solar. Figure out how to re-knit the food systems that actually support healthy people and healthy communities. There's a whole set of initiatives now that are happening around the country where the hospital, the school system, in some cases the universities, are working together to transform the supply chains in those communities and to create jobs and to create kind of a righteous economy that supports health, as Ray Baxter has talked about, supports health along the entire supply chain, supports not just community health, but community wealth creation. And finally, healthcare people, clinicians, doctors, nurses, professionals, they're the most respected members of our society. And so how can we elevate their voices and activate their voices to be messengers for policies and practices that make environmental health a priority to address population health issues? And in many ways, we need to be having them activate themselves to be leaders around the need for policies that will phase out the most toxic chemicals in our society, that will make the transition to renewable energy and policies that support that, that begin to put a price on fossil fuels, including the health impacts of fossil fuels in our society, which are largely out of the equation of the kilowatt hours. And this is being expressed by health institutions in many different ways. As I mentioned, there's huge investments happening among lots of hospital systems to be leaders in renewable energy investments. And it's also being expressed in the desire to divest from fossil fuels. If we want society to stop smoking cigarettes, we get doctors and nurses to stop. We ban it from hospitals. We begin to calculate the social costs of cigarette smoke. We decide that we're going to divest from tobacco companies. We work with attorney generals in the states to say that we need to capture the social costs of tobacco. We even stop taking money from tobacco companies as political candidates. And so I think we're on the same trajectory around fossil fuels, and fossil fuels are the new tobacco. And so our view is that healthcare institutions, insurers, pension funds, associations need to be validating the critical need to stop investing in an industry that's actually creating an enormous public health challenge around the entire world, and to start using their investments to invest in the future, which is all about population health at a grand scale. The lessons learned, we found that it's really critical to educate the health profession around environmental health. It's just not part of the education in general, and so people have to become literate. If we're going to address population health issues, they have to understand how the environment impacts people's health, how food does, how climate change does, how toxic chemicals do. We've had to appeal to, obviously, the mission, but also the mandate under the Affordable Care Act, and also the fact that many of these sustainability measures save money, enormous amount of money. We've had to provide very practical solutions to hospitals that are totally strapped for energy and time, and say these specific activities will achieve good performance. We've had to create healthy collaboration as well as competition. People in healthcare compete with each other across different markets, and at the same time they're willing to collaborate for larger goals, and so we have done that. Importantly, I think we've also learned that because of the healthcare sector's enormous economic power, if you aggregate that purchasing power, we can transform the economy in a very powerful way. And what Larry talked about in terms of what Walmart can do, healthcare can do the same thing, and it's even larger when you put it together. And of course, it's really important to celebrate success so that we're showing by example how things can be done, and everybody can be patted on the back for the great work that they're doing. From a movement level, I would say these are the lessons that it's important to create both inside and outside strategies. So there's a lot of pressure coming from students all over the country on many institutions and faith-based communities around issues around divestment, around issues around toxic chemicals, and that outside pressure also helps inside institutions to say we need to do something about that. And I think that works well together. I'm going to be done in a second. There's obviously a kind of interplay between policy and markets working together. It's great to have policy, but in many cases you can move the market a lot faster. It's important to build networks because I don't think any monolithic organization is going to change issues around population health. It's got to be a team sport. It's got to be a network, and there's a lot of good science and strategy about how do you build networks. It has to involve joint ownership of agendas and strategies. In this Healthier Hospital Initiative, all 12 hospital systems co-developed the metrics we were going to use. As Marcus said, it's about building trust over time. It doesn't come immediately, but it's about long-term trust-building relationships. This is not a 100-yard dash to address population health. This is the marathon. We've also understood that we need to make the movement international because we can do everything we can to support population health, community health issues, environmental health issues in this country, but most of the environmental issues that we face now are global issues. So we need to make the movement international. And for those who like to knit, I think it's all about learning how to knit partnerships together. And this is it's more art than science, but there's a real importance about learning how to knit people together over time. Thanks so much.
We're just 10 minutes behind schedule. I would propose we try to take a 10-minute break. And if you're going to follow Ray's advice, 10 minutes of vigorous physical activity on the break, as opposed to looking at your screen. And we'll reconvene about 10 minutes to the hour, hopefully.